For hundreds of years, research neurologists have treated the brain and body as if they are two separate entities. Well, what if neurologists treated the brain and body as if they were one whole entity? What if research proved exercise, nutrition, and hormonal support can speed the development of new brain tissue? And what if you were one of the first neurology centers to offer such treatment to support and reverse the effects of dementia, Alzheimer's, traumatic brain injury, and PTSD? Well, such a program does exist. Welcome to the Institute of Nutritional Medicine and Cardiovascular Research.
Folks, throughout history, technological advances have changed the landscape of medicine. In 1903, 99% of the population thought that a human being couldn't fly, and the Wright brothers turned that around. The Hubble telescope, once it was launched, changed the way astrophysicists looked at the universe. Now fMRIs allow us to look inside the brain in real time. We could watch the development of new brain tissue, things we never saw before. We could see with fMRIs, and that's changing the landscape of neurology.
The Institute has developed a neurological brain rehabilitation treatment program that is customized to each patient's unique metabolic and genetic DNA structure. This treatment corrects nutritional and hormonal deficiencies, which in turn speeds the healing process and slows the symptoms that patients encounter.
The evolution of this program started for me about 30 years ago when I was treating brain injury patients on emergency scenes, and it always stayed with me why one person would leave the hospital a lot sooner than the other, why one person would heal faster. 4 years ago, Louis Amabile was involved in a massive accident that caused severe traumatic brain injury. After Louis went through multiple physicians during his rehab process, he came to us for an aftercare program.
I had a neurologist, an optometrist, an orthopedic surgeon, a facial reconstructive surgeon, and a doctor for the Center for Disease Control because of the infections I encountered. Well, here we are about a year, almost a year and a half later, and the only doctor I see now is my general practitioner. I have had no follow-up with any of the other doctors other than the optometrist I've seen twice just to check my eyes, which definitely have decreased since the accident. I've got no prescribed aftercare other than medication to help me with the pain.
At the time of Louis's rehab, he had 5 physicians. After his rehab process was over with, he had no aftercare program, and that's why he came to us, and that's what we developed for Louis.
In April of 2009, I had a very tragic motorcycle accident. Had traumatic brain injury, a lot of damage to my body physically, broken bones. I was in the hospital in ICU for 8 days, and I was in and out for surgeries over the next 4 months. After that 4-month period, there was just not a lot of doctor care. I went back and forth between a few doctors for about a year, and then I was pretty much left to fend on my own. Had a lot of issues after that first year. Depression, I lost my business, no motivation. It's really almost hard to describe. It was not Louis Amabile. It was like someone else had taken over my body, and I was not able to get anything done. I hooked up with the Institute and got on this program that really helped me start to change things. It didn't happen overnight. We're talking, it's been 4 years now. There's been a lot of hard work, a lot of research, a lot of reading, a lot of things to get me to where I am today. Like I said, 5.5 years ago after that accident, the first 12 months passed and I had no business, I had no income. Today I run a multi-million-dollar business. I have 8 employees. I'm here every day, I'm banging it out. I follow the program, which has done, I can't tell you how much it's gotten behind me. I can make a phone call when I need information. I'm getting supplements, I'm getting everything I need. It's really come full circle. I was that person prior to the accident, and I truly believe, with some changes, some things are different, that I'm back to being that person again.
Every traumatic brain injury patient is biochemically unique. So what we did different is we're able to customize these treatment protocols based on advanced testing. That allows us to develop an aftercare program that's not offered anywhere in the U.S. yet.
For most patients, the rehabilitation process from traumatic brain injury is a 2-year process involving several doctors with limited, if any, interaction with each other. This leaves the patient isolated and feeling alone, having to find answers on their own. The Institute's program reduces that exploration and treatment time to less than 90 days by guiding the patient through the rehabilitation and recovery process.
From a business development standpoint, with our research lab and pharmacy and our team, we could plug this into a neurology practice to take care of existing patients with an aftercare program that's customized to each patient. This aftercare program allows a neurology practice to plug this into their existing client base and develop revenue for up to 2 years after the rehab process.
Everybody and everybody has a story. Let us find out yours today.